All right, welcome back to this next video that we're going to have under respiratory system examination. And what we want to look at is now the chest. The chest. Now, under the chest, what we should know is that we have the anterior chest and we also have the posterior chest. Okay? So you don't have to forget the posterior aspect of the chest. And in doing this, in examining the chest, we go by what is called the IPPA system. Okay? That is inspection, percussion, palpation, percussion, and what? And auscultation. Okay? So let's look at inspection. So on inspection, you can look at things such as the shape. Okay? You can look at the shape. You can look at things such as scars. You can look at things such as symmetry. Okay? And what else? Any chest deformities. Okay. So, for example, on the shape, anyway, this may be under the same chest deformities and shape may probably be the same. However, the other thing that you also don't want to forget things such as any respiratory distress. Okay, is there any respiratory distress? Obviously, you could have observed that also in your general inspection. Okay. Now, there are the number of pathologies that can distort the shape of the chest, right? There are a number of such pathologies. Okay. Now, such pathologies, for example, you can have things such as barrel chest and pigeon chest. Okay, where barrel chest is where the anterior posterior diameter is increased. Okay, that is barrel chest. The posterior anterior diameter is increased, and then we can also have pigeon chest and so on. So you look at the shape of the chest, and also you also have the deformities. Okay, so under deformities you can have things such as scoliosis, kyphoscoliosis. You can also have things such as pectum excavatum, and so on. All right. Then, when you look at scars, here you can look at traditional tattoos, for example, especially in our setting. Okay, traditional tattoos. Traditional tattoos, those are also going to indicate the chronicity of the condition. Remember, like I explained last time, if the patient has had a condition for a long time, then they become more desperate. They want to find their solution, the solution to their problem. So they tend, and also especially in rural areas, because in rural areas you find that there's always that behavior not to seek for medical attention from the hospital. People want to go to witch doctors, herbalists, and so on. So you're going to find those tattoos on the chest. Okay. You can also find other things like surgical scars. Okay, let's say for example a patient has a thoracotomy, a patient had some chest drainage. Okay, chest drain. You're also going to find all those things. You also look at any other skin discolorations. Okay, are there any skin discoloration? Are there any, for example, things like keloids? You know that keloids are like to be found on the sternum, just on the surface of the sternum there. So you can find all those. Okay. Then symmetry. You want to look for the symmetry. What is the symmetry of the chest? Okay. Do you think one side of the chest is rising more than the other? Okay, as there is during inspiration or during expiration. Okay, So you also look out for all those. Right. Then things like respiratory distress, is there any labored breathing, and so on. All right. Then you also look at respiratory rate, like I already mentioned, I think. Is there tachypnea, or is there increased respiratory rate, or is there decreased respiratory rate? Okay. Then also chest expansion. Okay, chest expansion, you look at it better under palpation. All right, look at it better under palpation. So those are some of the things that you want to look out for under inspection when inspecting the chest. By the way, the same things that you're looking at on the anterior chest is basically the same things that you also go for on the posterior chest. You also look at the shape, you look at the scars, are there any scars, you look at the symmetry, and so on and so forth. Okay, so that's about inspection. Let's look at palpation. Now, so we look at palpation. Basically, here you can do some light palpation. Okay. So when you're doing palpation, you want to feel, for example, like light palpation, you want to feel for things like superficial masses, or swelling. Okay. Is there any tenderness? For example, in the case of, let's say there is a foreign body, or maybe there is, let's say there's foreign body, or maybe there is a fractured rib, right? So you have to be careful anyway, okay? So you may find, and also in the case of, let's say, costochondritis, you may find that there's going to be tenderness, okay? Then the other thing that you also want to do, you want to look for expansion, chest expansion. Now, what you do on chest expansion, okay, you wrap your hands, all right, around your fingers around the patient, and then the thumbs come in front like that. I'll try to demonstrate on myself somehow. I hope I manage. So you find that when you do that on the patient, okay, you ask the patient to take a deep breath. Okay, they breathe in and out. So as they breathe in, you will know that what is going to happen is that the chest is going to expand. Okay, when they breathe out, it's going to the expansion is going to decrease. Okay, so there may be increased expansion or decreased expansion of the chest. Okay, so if expansion is less than 5 centimeters, okay, this is abnormal. Okay, expansion is supposed to be somewhere around 5 centimeters, and what can cause decreased expansion? You can have unilateral expansion or bilateral expansion. Okay, so with unilateral decreased, if there's decrease in expansion on one side of the chest, okay, just on one side, there may be a pathology either on that same side of the chest or on the other side of the chest. For example, if there is a lung collapse, then you find that on that side of the chest there's going to be decreased expansion, or on the other side there's going to be increased expansion of the chest. You can also have increased expansion on both sides of the chest. Okay, so those are some of the things you can look at: expansion of the chest, and then you can also look at tactile fremuters. Okay, tactile vocal fremuters. Now, we're going to talk about this under auscultation, where we look at vocal fremuters. Okay. However, maybe just to mention a little, what you do is you touch the chest wall of the patient, and then you ask them to say something such as 99. Okay. So what you find is that there's going to be increased fremuters, tactile vocal fremuters, in a case where there is consolidation. Okay, I'm going to explain a bit more in details under auscultation. Okay, then let's look at percussion. So like I've already mentioned, basically what you're doing on the anterior chest is what you do on the posterior chest as well. So let's look at percussion. Okay, so percussion, what is the technique? Okay, what is the technique? Now, this was developed by a doctor called Leopold, I think in the 1700s. Okay, Leopold. Now, what happened? Leopold, his father used to, if I'm not mistaken, used to what term can I use? Like he would put alcohol or sort of wine in a glass, for example, okay, in a bottle or in some sort of a vessel, and then he would want to know where the level of that wine. Okay, so he would use some small sort of a hammer and then hit on the wall of that vessel, and then depending on the sound that is produced, you would know that okay, the wine is reaching in this level. Now, when this guy went into medical school and became a doctor and stuff, he remembered what his father used to do with the wine to know the level and so on, and then he applied that in medicine, and that's where this technique of percussion came from. So now, when you look at percussion, what is very important under percussion, okay, is to know what is normal and what is abnormal percussion note. Now, knowing the normal percussion note also requires you to know the specific landmarks, the surface landmarks of the chest, okay, surface chest anatomy. You need to know that for you to be able to know where do you expect a particular sound. For example, let me try to draw this. So let's say that is I have a patient, person like that. Okay, and then let's say we have something like that, and then you have maybe the nipple there. You have the nipple somewhere there like that. Okay, so now what we understand is that as you are coming down, okay, as you're coming down from the trachea, okay, so we have the sternal notch. So you have the sternal notch there, right? You have the sternal notch. Then just down, when you come down there, you're going to find what is called the angle of Lewis, okay? The angle of Lewis. Now, at this level of the angle of Lewis, this angle of Lewis is very important because that's where you find it's the level of the right atrium. It's also the level of the bifurcation of the trachea and so on, okay? Other than that, this is where almost exactly where the second rib joins, okay? The second rib joins somewhere there. So it means that just below the angle of Lewis, that's where you have the second intercostal space, okay? So you have the second intercostal space somewhere there, and then you start coming down. Now, the other thing that we want to know is that you want to know where is what is called the horizontal fissure of the lung and the oblique fissure of the lung. Now, it would have been easier to demonstrate if there was someone around. Now, what I really want to demonstrate is there are three numbers that are very important. That is 5, 7, and 9. Okay, 5, 7, and 9. Now, 5, the fifth intercostal space in the mid clavicular line. So first of all, you have so for example, you can find the fourth intercostal space probably somewhere here, and then the fifth intercostal space maybe somewhere there. And then The fifth intercostal space can be found maybe around that region, the nipple region, okay, in the mid-clavicular line. Then you also have, you go in the mid-axillary line, you palpate for the seventh intercostal space, okay, in the mid-axillary line. So you're going to have a line like that, and then you also have the ninth intercostal space in the mid-scapular line. So you go on the posterior aspect of the chest, you get the ninth intercostal space in the mid-scapular line. Now, what is going to happen is that when you join those points that you're plotting, when you join those are the landmarks of the liver. That's where the liver, that's the border of what? Of the liver. Okay. So remember on the left side, just below the lungs, that's where you have what? You have the liver. Okay. Now, why is that important to know? It's important to know because as you are percussing, okay, when you percuss on a region where there is the lung, okay, the sound that is going to be produced, the percussion note, is going to be different as that is where the liver is. Okay. Now, what is the technique? You separate your fingers like that, and then you place this middle finger right in the intercostal space. All right, on the intercostal space, firmly, not loosely. You don't have to press them loosely, but firmly, and then you percuss with the middle finger on the other hand, on your right hand. You percuss so that it's going on the middle phalanx there. Okay. Now the wrist has to be flexible enough. Okay. So you don't have to percuss with the whole hand going like that, but it has to be, the movement has to be on the wrist. Okay. So like that. So it has to be flexible enough like that. All right. Now, what happens as you percuss from up there coming down? Okay. You have to, by the way, you have to be comparing the left and the right. You percuss on the left. On the right, you percuss on the left, you percuss on the right, you percuss on the left. You are comparing, right? Now, as you are percussing in this region, because we understand that here there is basically just the lung, okay? There's a lung there. So the normal percussion note, it has to be resonant, okay? It has to be resonant. Now, obviously, I can't produce that resonant sound on the board here. So you're going to be able to know and identify these sounds with more practice, or you can listen to some audios that there are quite a lot of audios on the internet, on YouTube, and so on. Those can help you to be able to identify these sounds. So the normal percussion note on the lungs is what? Is resonant, the resonant sound. Okay. Now, as you percuss from up, coming down, when you reach where the liver is, because the liver is a solid organ, okay, this is for region of the lung, okay. Now, when you reach where the liver is, you're going to find a downness. There's going to be downness there, okay. When you find where the liver is, you're going to find some sort of what? Downness, okay, on the liver. Now, where else do you find downness? Okay, where else do you find downness? You also find downness on the region where there is the heart. Okay, where there is the heart. Remember, the heart is a fist kind sized organ like that, somewhere there. So when you percuss anywhere in this region where the heart is, you expect to find downness there. Okay. Then you can also find some sort of tympanic sound. Okay. Now, what you do is you check for the sixth intercostal space, right? The sixth intercostal space in the left mid-clavicular line, okay, which may be somewhere here. Let me put it somewhere there. The sixth intercostal space, all right? And then you draw a vertical line coming down until it reaches where there is that costal margin. So there's the costal margin here. Those are the ribs. So it reaches somewhere there. And then you also draw you also locate another point in the mid axillary line, the anterior axillary line in the 9th intercostal space, probably somewhere there. You also draw a vertical line. So what is going to happen? You can join this point and that other point. Okay. So this region here, okay, this region is very important. It's very, very important because that is where you find what is called the gastric bubble. Okay, the gastric bubble. Okay, so it means that as you are percussing, okay, as you are percussing from up here, you're going to have resonant sound. As you continue coming down, okay, as you continue coming down, you're going to find what? You're going to find downness because of the heart, and then further down you're going to find a tympanic what? A sound, okay, because of this gastric bubble. So that is what is normal, okay. Now you have to look out for what is abnormal. What are the abnormal sounds? Okay. Now, abnormal sounds, for example, you can have one what is called if you find, let's say, resonance where there's supposed to be downness, or you find tympany where there's supposed to be resonance, obviously it's abnormal. But let's look at it. Hyperresonance. Okay, hyperresonance. Hyperresonance, it means that there is too much air in the chest. There's so much air. Okay, and then that can happen in cases where there's hyperinflation and so on. All right. Then you can also have a stony down percussion note. Stony down percussion note occurs when there is fluid, such as in cases of when there's fluid in the lungs, you're going to find what? You're going to find downness. Then you can also have number 3. You can also have downness. Okay. You can also have downness in the region where there's supposed to be resonance. You find downness. This indicates what? Things such as consolidation. Okay, consolidation. And it can occur in things such as pneumonia or even TB. Okay, so basically those are some of the percussion notes, but you need to learn the technique, especially when you have a patient and so on. It's going to help you even more. Okay, so I think let's look at auscultation. Now, we look at auscultation. Okay. When you look at auscultation, I hope I've already seen that. I think my the memory of my phone is full already. I hope we managed to get through. So on auscultation, I don't know. Maybe I should just make a separate video. Let me see what we can do. So let me end this one right here, and then I'll probably make a separate video.